Morning, I'm Dr. Arunesh Kumar. I'm Senior Pulmonologist at Mediclinic. Today we are going to talk about asthma. I think this cannot be more relevant as the timing we are going through is one where we come across the increased pollution level in our atmosphere. Asthma is a disease of allergy and hence it is affected by your environment and the air you breathe in. Essentially, it is a reaction which is produced by the pollutants when you breathe in, and it creates an inflammation surrounding your airways, leading to narrowing of your airways, producing a sound which we call wheeze. Also, you become breathless, and sometimes because of the increased secretion inside your airways, you produce inflammation and consequently you develop infection. Asthma is a disease of allergy. This is the allergy we sometimes inherit as we are born, or sometimes we develop it as we grow older. Sometimes asthma can be because of the external allergy, sometimes it is because of your innate allergy. As a physician, we try and find out the exact cause and then try and treat. But for you as an individual, it's very important to understand when you are losing control of your asthma or if you have got an asthma. With the changing extent and the changing the environment around us, we are more often seeing the new diagnosis of adult onset asthma, which was a rarity in the past. This is because we come across so many different pollutants such as pollen, such as petroleum, diesel, nitrogen dioxide, and the suspended particles in the air, which keep on producing the inflammatory reaction within our lungs. And we end up generating too much of inflammation within the airways, and they become narrow, and consequently we become breathless. It's very important that if you notice symptoms such as wheeze, breathlessness, fever, and the cough, which is more than 3 weeks and for which you don't have any reason, you should see a pulmonologist at your earliest convenience, because this can very well be an asthma. We as a doctors examine you, find out, and give you a diagnosis of asthma. Asthma has got a very good treatment available around, so that if you are started on it, your quality of life improves once you are on it. The danger of leaving asthma untreated is you can develop what we call irreversible airflow obstruction, where the treatment becomes difficult as compared to the asthma which responds to the bronchodilators. For those who already have got a diagnosis of asthma, it's very important that you are compliant with your inhalers. One type of inhaler is a preventer inhaler, which essentially prevents the exacerbation or the flare-up of your symptoms. All the asthmatics should be compliant with flu jabs, flu vaccines, and pneumococcal vaccines. Pneumococcal vaccine we administer every 5 years, and flu vaccine we administer every year. Most importantly, when the pollution level goes up, try and avoid doing excessive exercises outside the air where your chances of getting flare up is higher. Also, use mask if possible. The type of mask I advocate using is N95 mask, which prevents most of the pollutants, which is harmful to your lungs and airways, from going in. And more importantly, if you feel that your lung conditions deteriorate, you should see a pulmonologist at your convenience as soon as possible. I hope this talk helps you, and I wish you very well for the coming festive year. Thank you very much.